Hi, my name's Lucy Gunn and my USI is DTP RSX PY2S. The location of my workplace is at the Hobart Animal Hospital and my supervisor is Grace Warren. So there appears to be a dog that has been hit by a car over here. But before I can go over and assess it, we just need to go over some safety first. So checking the road, or in this case a car park, to see if there are any cars coming or exits. Okay, so we are unsure as to what might have happened here, as there are no other physical signs of injuries, so we're assuming that the dog's been hit by a car. So we're going to approach the dog calmly and quietly, just so it doesn't get frightened or becomes aggressive. But before I do that, I do need to make sure that I've got some essentials, such as a towel to put over its eyes or use as a carrier, and I've also got a little bandage here that I might need to use as a muzzle. Luckily this dog has a collar, which will make it quicker and easier to capture, as well as seeking out the owner's details and getting them informed of what has happened. Okay, so I can feel and tell that the dog is distressed, however the breathing isn't strained. So I would just check the pulse or the heart rate of the dog by placing my hands low on the dog's chest here near the elbow joint, feeling the heartbeats. So by counting how many beats I feel in 15 seconds and then multiplying that by 4. So this dog's heart rate is about 160 beats per minute, which is quite rapid. An average healthy dog's heart rate should be between 60 to 130 beats per minute. We will need to locate this dog to a vet as soon as possible for a physical examination. However, we must be extremely careful that the dog doesn't further injure itself by moving or potentially becoming aggressive and biting or wanting to run away, therefore causes more discomfort and pain. Using this bandage, I'm going to muzzle the dog, tying it around the muzzle and then behind the ears loosely, so if it is panting, it's obviously still able to pant and whatnot. So now that the dog is muzzled and I have evaluated the situation myself, I'm going to call my supervisor to get her to help me lift it, just so I don't make any further injuries to the dog by myself. When she comes here, we'll just evaluate the situation again, discussing it, and come to a conclusion as to whether we use the towel to carry the dog or we bring certain emergency equipment to the dog. If the bleeding was excessive, I would bandage it. Usually we'd want to disinfect it first and put a clean gauze swab on it. However, in the current situation, we just don't sort of have those resources. What I'll do now is go contact my supervisor, making sure someone just stays with the dog whilst I'm on the phone so the dog doesn't try and run away or further injure itself, and we'll get him treated.